Hello, I'm Dr. Frances Pitsillis. What can be done about rosacea? Well, rosacea is a condition that some people call acne rosacea, but it's not the same as acne. It looks a little bit acne-like. So you've got a lot of redness usually across the cheeks and the nose, but you don't get the blackheads. Well, 5% of people get this problem, often over the age of 30. We're not sure what causes the problem, except we do know that anything hot causes it to flare up. So spicy food, hot weather, hot emotions, etc. Although we do know that inflammation is part of it because it causes inflammation of the blood vessels and the skin. So therefore, when there's inflammation, that means something's going on inside of the body. There have been some theories about a mite called Demodex, and also there's been some information in the literature on Helicobacter pylori in the stomach. And in fact, I've seen a couple of cases lately whereby we fix up the Helicobacter pylori and the rosacea goes away. So we know something's going on in the gut to then affect the skin to cause the inflammation. So what can you do about rosacea? Well, I think it all starts with internal health, getting your diet right, making sure that perhaps you could even consider a probiotic, and because the stomach may have something to do with it, you may consider apple cider vinegar or gastric acid, but that's only my viewpoint. It's not in the scientific literature. What is in the scientific literature is that it may be worth fixing up the Helicobacter pylori. When it comes to skincare, you need to avoid oily type skincare and have water-based skincare, and sometimes you can use vitamin A derived creams. The medications that can be given for rosacea include tetracycline, antibiotics which reduce inflammation, or even metronidazole, or even isotane from vitamin A. So this is oral isotane. When it comes to clinic treatments, the sorts of things that work very well for rosacea are laser and light-based therapies. A lot of people offer an IPL, intense pulsed light treatment, which works very well on the superficial layers of the skin, and they don't offer anything other than that. However, what does help along with that is another light-based treatment called a 1064 nanometer laser. And this gets into the deeper layers in the skin, and that way you can have the whole thing improved quite a lot more. So having both of those treatments together is much better. But then you wonder, well, will it come back again if there's something else going on inside of me? So I think that along with looking after your general health, I think it's important to correct deficiencies in your body like magnesium, zinc, vitamin C. In addition, I think it's important to take fish oil, which will reduce inflammation. But one of the most important things about this condition is that it can be quite scarring if it's not treated properly. In fact, people can get a rather knobbly sort of red swollen nose, which some people call a drinker's nose. So apart from all of what I've just said, I think the most important thing is to be vigilant about this condition and get some help for it, because if it continues, it might cause scarring. So it's about inside treatments like diet, supplementation, correcting imbalance, and it's about outside treatments like intense pulsed light and the laser, which is painless by the way, and it's about supplementation and drugs.